Victory for infertile women after the successful pregnancy of a woman who underwent an ovarian tissue transplant.
The story happened in Belgium, but doctors here are watching with great interest. Health Check's Christy Myers joins us now from the 13 Health Center with much more on the breakthrough. Christy?
Art and Melanie, for years, doctors in the U.S. have been trying to do the same thing, taking tiny sections of the area around the ovary, which holds microscopic eggs, and freezing it. If women can have successful pregnancies with frozen ovarian tissue, which holds tiny unfertilized eggs, it removes the ethical dilemmas involved in freezing embryos.
In this incubator is a tiny petri dish that holds newly retrieved eggs and the hopes of a Houston couple to have a baby. The eggs will be studied and sorted based on their quality. The best eggs will be selected to be injected with sperm. Warda Purat didn't have eggs to inject with sperm. Hers were blasted with chemotherapy, which saved her life but cost her her fertility. Yet 7 years later, she gave birth.
I'm very, very happy. Yeah, very happy.
Baby Tamara was the first child born of transplanted ovarian tissue. That means that tiny sections of her mother's ovarian tissue, which holds microscopic eggs, had been frozen, thawed, and then placed near blood vessels, which helped it implant and grow.
I mean, this has never been done in the history of the world. Frozen ovarian tissue, which has resulted in a live birth. So, we've been trying this for years and years.
The reason this research is so important in helping protect a young woman's fertility is that the other method, freezing the eggs, has had a very low success rate.
Freezing eggs hasn't worked well, but labs like Dr. Hickman's Houston IVF have been successfully freezing embryos for decades. Some embryos have been frozen for up to 13 years and produced healthy babies. But the ovarian tissue transplant is important in helping women facing chemotherapy who do not have a sperm donor and for whom freezing an embryo is not an option.
But it's still experimental. I mean, we have to say that. We're assuming that there are no risks to the baby. That there's no damage to the embryo or to the eggs that are frozen for such a long period of time.
But for this Belgian woman, the reward was worth the risk.
It's a dream. It was a dream.
Now, doctors in the U.S. have tried ovarian tissue transplants, but so far none has been successful. As the technique used in Belgium is repeated and perfected, hopefully we will see successful pregnancies from it here. And as a perspective, it took in vitro fertilization a decade to become mainstream. With today's Health Check, I'm Christy Myers, 13 Eyewitness News.